Welcome back to the channel. If you are new here, we focus on practical, research-backed health information specifically for adults over 60, their caregivers, and their families. Today we are talking about something incredibly common yet almost never discussed: your sleeping position and how it directly affects the strain on your heart, your risk of blood clots, and even your chances of stroke while you rest. Now, you might be thinking, I have been sleeping the same way for 40 years. How could that possibly matter? That is a fair question. And it is exactly the reaction most people have, which is why this information flies under the radar. But your body at 65 is not the same body you had at 35. Your blood vessels are stiffer. Your heart muscle may have thickened slightly. Circulation does not move with the same easy force it once did. And gravity, that constant, invisible pull, affects how blood pools, how pressure distributes, and how hard your heart has to pump depending on whether you are flat on your back, curled on your left side, or sprawled face down on your stomach. So let us walk through what the research actually says, which position appears to offer the most benefit, and why such a small change in your nightly routine might genuinely protect your cardiovascular system for years to come. Stay with me on this one. It could be one of the most useful things you learn all month. Let me paint a picture for you. Imagine a garden hose. When that hose is brand new, the rubber is soft, flexible, and water flows through it without any trouble at all. But after years sitting out in the sun, that rubber gets stiff. It cracks a little. You have to turn the faucet harder just to get the same amount of water to the sprinkler at the end. Your circulatory system works in a remarkably similar way. After decades of use, your arteries lose some of their elasticity. The walls thicken. Tiny deposits of calcium and cholesterol may narrow the pathways blood travels through. Your heart compensates by working a little harder, pumping with a little more force. And for most of your waking hours, your body manages this beautifully. You stand, you walk, you sit, and a complex network of valves, muscles, and reflexes keeps blood moving where it needs to go. But when you lie down, the rules change. Gravity, which normally pulls blood downward toward your legs and feet when you are standing, suddenly redistributes that blood across your entire body on a horizontal plane. More blood returns to your heart. The chambers fill with greater volume, and your heart has to adjust its output accordingly. For a healthy 30-year-old, this is nothing. The heart adapts seamlessly. But for someone over 60, especially someone managing high blood pressure, mild heart failure, atrial fibrillation, or arterial stiffness, that sudden redistribution can place real, measurable strain on the cardiac muscle. This is why many seniors notice they feel more short of breath when they first lie flat. Some even wake up in the middle of the night gasping slightly, needing to prop themselves up on an extra pillow. Cardiologists actually have a clinical term for this, orthopnea, and it happens precisely because the heart struggles with the increased blood volume returning to the chest in a flat position. Now multiply that nightly strain across 7-8 hours of sleep. Multiply it across 365 nights a year. Multiply it across a decade. You begin to see why sleep position is not a trivial detail. It is a cumulative cardiovascular factor that almost nobody talks about. And here is where it connects to something even more serious: thrombosis. Thrombosis is simply the formation of a blood clot inside a blood vessel. When blood flow slows down or pools in one area for too long, clotting factors in the blood have more time to stick together and form dangerous clumps. During sleep, if your position compresses certain veins or restricts circulation to specific limbs, you may be unknowingly creating the perfect conditions for a clot to develop. If that clot breaks loose and travels to the lungs, it becomes a pulmonary embolism. If it reaches the brain, it becomes a stroke. These are not exaggerations. These are documented medical events that happen to real people, often during or shortly after sleep. So the question becomes straightforward. Is there a sleeping position that reduces this risk? The answer, according to a growing body of evidence, is yes. The position that appears to offer the most cardiovascular benefit for seniors is sleeping on your right side, with your knees gently bent and a pillow supporting your head at a comfortable neutral height. Let me explain exactly why, piece by piece, So this makes complete sense. Your heart sits slightly left of center in your chest. Most people know this, but they do not think about what it means in terms of gravity and pressure during sleep. When you sleep on your left side, the weight of your body compresses toward the heart. Your lungs, your mediastinal structures, the tissues and organs in the center of your chest all shift slightly under gravity's pull, pressing against the heart. For some people, this creates a subtle increase in cardiac workload. Research published in the Journal of the American College of Cardiology has noted that patients with congestive heart failure who sleep on their left side often show measurably higher sympathetic nervous system activity. That means their bodies are in a slightly elevated stress state, a low-grade fight-or-flight mode simply because of position. Now flip to the right side. The heart is no longer being compressed beneath body weight. Instead, it sits in a relatively unburdened position within the chest cavity. Blood returning from the body through the inferior vena cava, that large vein running along the right side of the spine, flows more freely into the right atrium of the heart without gravitational obstruction. The heart fills more efficiently, pumps with less effort, and your entire cardiovascular system operates with reduced resistance. Think of it like this. Imagine you are carrying a heavy backpack. If someone stacks another 10 pounds on top of that backpack while you walk, every step becomes harder. But if someone removes 5 pounds, suddenly each step feels lighter, easier. Sleeping on your right side is like removing that extra weight from your heart's overnight workload. But the benefits extend beyond just cardiac strain. Let us talk about blood clots and thrombosis prevention. When you sleep on your right side with your legs slightly bent, ideally with a pillow between your knees to keep your hips aligned, you maintain open, uncompressed circulation through your femoral veins, the major blood vessels running through your thighs. This is critically important. Deep vein thrombosis, or DVT, often begins in the legs when blood flow stagnates. Seniors who sleep flat on their backs sometimes cross their ankles unconsciously or let one leg press heavily against the other for hours, subtly restricting venous return. The right side position with a knee pillow prevents this compression entirely. And then there is the connection to stroke prevention. There are two primary ways sleeping position may influence stroke risk. The first is through blood pressure regulation. Studies have shown that right-side sleeping tends to produce slightly lower overnight blood pressure readings compared to supine or left-side sleeping in older adults. Since sustained high blood pressure is the single greatest risk factor for stroke, even a modest reduction during 7 or 8 hours of sleep adds up to meaningful protection over time. The second mechanism involves something called glymphatic clearance. Now, I want to explain this simply because it is fascinating. Your brain has its own waste removal system, a network of channels that flush out metabolic debris while you sleep. Researchers at Stony Brook University found that side sleeping in general appears to enhance this glymphatic drainage compared to sleeping on your back or stomach. Efficient brain waste clearance is associated with reduced risk of neurodegenerative conditions and may also lower the likelihood of the small vessel damage that contributes to certain types of stroke. So when you combine reduced cardiac strain, improved venous circulation, lower overnight blood pressure, and enhanced brain waste clearance, the right side sleeping position emerges as a remarkably powerful yet completely free intervention for cardiovascular and cerebrovascular health. And you do not need a prescription, you do not need expensive equipment, you just need to roll over. If you are over 60 or if you are caring for an elderly parent, spouse, or loved one, this information could genuinely be life-saving. I want you to do something right now. Think about the person in your life who needs to hear this. Maybe it is your husband who has been managing blood pressure issues. Maybe it is your mother who had a minor cardiac event last year. Share this video with them. Send them the link. Sometimes one small piece of knowledge, passed along at the right moment, makes all the difference in the world. And if you have not yet subscribed to the channel, tap that subscribe button so you never miss videos like this one. Now that we have covered the optimal position, let us talk about the ones that may be quietly working against your heart and circulation overnight. Sleeping flat on your back, the supine position. For younger, healthy adults, back sleeping is often recommended for spinal alignment. But for seniors with cardiovascular concerns, lying completely flat can be problematic. When you are supine, gravity pulls blood from your extremities directly back toward the heart and lungs with maximum efficiency, which sounds beneficial until you consider that an aging heart may not handle that sudden volume increase gracefully. This is precisely why so many older adults with heart failure are told to elevate the head of their bed or use two pillows. Flat back sleeping can increase preload, the amount of blood filling the heart before each contraction, to the point where the heart muscle stretches beyond its comfortable working range. Additionally, back sleeping is strongly associated with obstructive sleep apnea, a condition where the airway collapses repeatedly during sleep. Each apnea episode triggers a spike in blood pressure, a surge of stress hormones, and a drop in blood oxygen. Over months and years, untreated sleep apnea dramatically increases the risk of atrial fibrillation, heart attack, and stroke. The tongue and soft palate fall backward under gravity when you lie face up, and for many seniors, this alone is enough to obstruct airflow dozens of times per hour without them ever waking fully or realizing it is happening. Sleeping on your stomach. The prone position. Stomach sleeping is perhaps the hardest position on an aging body. Your neck is forced to rotate sharply to one side so you can breathe, which compresses the vertebral arteries, small but vital blood vessels that supply the back of the brain. In older adults with any degree of cervical arthritis or arterial narrowing, this compression can reduce blood flow to regions of the brain responsible for balance, coordination, and consciousness. There have been documented cases of vertebrobasilar insufficiency triggered by prolonged neck rotation during sleep, leading to dizziness, visual disturbances, and in rare but real situations, posterior circulation strokes. Stomach sleeping also places significant pressure on the chest, restricting lung expansion and forcing the heart to pump against mechanical resistance from the mattress compressing the anterior chest wall. For someone with a healthy, strong cardiovascular system, this resistance is negligible. For a 72-year-old with mild diastolic dysfunction, it is an unnecessary burden every single night. Sleeping on the left side. I touched on this earlier, but let me add a bit more nuance. Left side sleeping is not dangerous for most healthy people. Many physicians even recommend it during pregnancy to improve placental blood flow. But for seniors who already have enlarged hearts, pericardial effusion, fluid around the heart, or congestive heart failure, the left side position consistently shows higher cardiac sympathetic activation in clinical studies. Some patients describe the sensation as a feeling of their heart pounding or thumping when they lie on their left side. That sensation is not imaginary. It occurs because the heart is literally closer to the chest wall in that position, and the additional gravitational load makes each beat more perceptible and, in some cases, genuinely harder for the muscle to execute efficiently. If you have ever rolled onto your left side and felt your pulse hammering against the mattress, your body was sending you a message. Listen to it. All right, so you are convinced. Right side sleeping sounds beneficial. But here is the reality. If you have been sleeping on your back or stomach for 30, 40, 50 years, changing that habit overnight is not easy. Your body has muscle memory. You fall asleep in the new position and wake up 3 hours later, right back where you started. So let me give you some practical strategies that actually work. First, the pillow barricade method. Place a firm body pillow or a rolled-up blanket behind your back once you settle onto your right side. This creates a physical barrier that prevents you from unconsciously rolling onto your back during the night. Your sleeping brain encounters resistance and stays put. It sounds almost too simple, but sleep therapists use this technique regularly with patients who need to avoid supine sleeping for apnea management. Second, the tennis ball technique. This one has been around for decades and remains effective. Sew a pocket onto the back of an old t-shirt right between the shoulder blades and slip a tennis ball inside. Wear the shirt to bed. Every time your body tries to roll onto its back, The discomfort from the tennis ball nudges you back to your side without fully waking you. Within 2 to 3 weeks, most people find their body has retrained itself and the shirt is no longer necessary. Third, invest in a good knee pillow. A medium-density pillow placed between your knees while you lie on your right side keeps your hips, pelvis, and lower spine in neutral alignment. This prevents the lower back pain and hip discomfort that often drives side sleepers to switch positions during the night. When you are comfortable, you stay put. Comfort is the foundation of positional consistency. Fourth, adjust your mattress firmness. Side sleeping concentrates your body weight onto a smaller surface area, primarily the shoulder and hip. If your mattress is too firm, those pressure points become painful, and you toss and turn all night searching for relief. A medium to medium soft mattress, or even a quality mattress topper with memory foam, can distribute that pressure more evenly across your side profile and let you maintain the right side position comfortably for longer stretches. Fifth, be patient with yourself. Habit change takes time, especially at this stage of life. You may spend the first week or two falling asleep on your right side and waking up on your back. That is completely normal. The goal is not perfection from night one. The goal is gradual, consistent improvement. Even if you spend 4 hours on your right side instead of 0, your heart experienced 4 hours of reduced workload that it did not have before. That matters. Every hour counts. One more note that I think is important. If you have a specific medical condition, a shoulder injury on the right side, severe acid reflux that worsens with right side sleeping, or a condition your cardiologist has given you specific positional instructions for, always follow your doctor's personalized guidance over general recommendations. Every body is different. General research points toward the right side as optimal for most older adults, but your physician knows your unique situation best. Before I wrap up, I want to highlight some nighttime warning signs that too many seniors dismiss or attribute to just getting older. These deserve your attention. Waking up gasping for air or needing to sit upright to breathe comfortably. This could indicate fluid buildup in the lungs related to heart failure. Do not assume it is just a bad dream, swollen ankles or feet that are noticeably worse in the morning than they were the night before. Overnight swelling suggests your circulatory system is struggling to move fluid effectively while you rest. Waking up with a racing heart or irregular heartbeat multiple times per week. Occasional palpitations happen to everyone, but frequent nocturnal episodes may signal atrial fibrillation, a rhythm disorder that increases stroke risk 5-fold. Persistent numbness or tingling in one arm or leg upon waking. If this happens repeatedly in the same limb, it may indicate vascular compression or early peripheral artery disease, not simply sleeping on it wrong. Severe, unusual headaches upon waking. Morning headaches can be associated with overnight blood pressure surges or oxygen deprivation from sleep apnea, both of which are cardiovascular red flags. If any of these resonate with you, please bring them up with your doctor at your next appointment. Write them down on a piece of paper and hand it to your physician so nothing gets forgotten in the rushed pace of a typical office visit. You deserve a thorough conversation about what your body is telling you at night. Let me bring everything together for you. Your sleeping position is not a cosmetic preference. For adults over 60, it is a cardiovascular variable that affects cardiac workload, blood pressure, clot formation risk, and even waste clearance in the brain. Sleeping on your right side, with knees gently bent and proper pillow support, appears to reduce nighttime strain on the heart, promote healthier venous circulation, and lower the mechanical burden that contributes to blood clots and stroke over time. You do not need surgery. You do not need medication. You need a pillow between your knees, a rolled blanket behind your back, and the willingness to give your heart a gentler night's rest starting tonight. Your heart has been beating for you every second of every day for 60, 70, 80 years. It has carried you through everything, the joyful moments, the hard ones, all of it. You can return the favor by giving it the easiest possible working conditions while you sleep. That is not a radical medical intervention. That is simply kindness toward the organ that has never once taken a night off. If this video gave you something useful, hit that like button so more people can find it. Subscribe to the channel if you want more senior health content that is practical, clear, and built around information you can actually use tonight. Share this video with someone you love, your spouse, your sibling, your parent, your neighbor. Drop a comment below and tell me how you sleep right now and whether you are going to try making the switch. I read every single comment and I would love to hear from you. Take care of that heart. It has been taking care of you your whole life. I will see you in the next one.